Hello, I'm Holly Bear. I'm a researcher at the University of Oxford, and my research relates to the implementation and evaluation of interventions for children and young people.
Hi, I'm Tim Clarke. I'm a principal research clinical psychologist in children and people's mental health. And a primary research interest of mine is how we implement evidence and research into practice to improve services.
What are the barriers to implementing research in children and young people's mental health?
Thankfully, we've done a systematic review looking exactly at barriers and facilitators to implementation in young people's mental health. So the core barriers that we found related to things such as clinician resistance, so the perception that research doesn't translate neatly into clinical practice, competing priorities and struggling to fit it into workload, inadequate awareness and knowledge, lack of structure as well in terms of service level structure, and also high staff turnover rates within children and young people's mental health services. From an organisational barrier perspective, we found that actually things such as time and resources, not having a job plan, funding, culture and climate and implementation readiness, as well as a lack of structure within services and lack of leadership support, all led to barriers in implementation.
What have you found out so far?
So what we found really from our research is, clinician attitudes and belief, really trying to get to those that really believe in evidence-based practice and give them the time within their jobs to be able to support the translation of research and evidence into practice was really important. Really valuing clinicians' kind of competencies and skills development to include research skills and evidence finding skills. Thinking about the individual characteristics of clinicians we found was really important. This kind of valuing them and valuing their willingness to adopt new practice. Education and training came up as a very key facilitator, which links to this kind of question of technology and using technology to further train and educate staff. And then from an organisational perspective, we found obviously having clear job plans with time embedded to nurture that kind of curious side of staff, to be able to find the new evidence and research and be curious about how to put that into practice was important. Working across the system with commissioners and having dedicated funding and dedicated roles for the translation of evidence research into practice is absolutely key, as well as skilling up our leaders and our wider organisations so that we can have a better kind of readiness to change. Culture within organisations, particularly within the NHS, is key as well.
What have these findings led to, and what is coming next?
So our programme of work is called Bridge, about bridging the gap between research and evidence, and Bridge stands for Building Research Implementation to Develop and Grow Evidence-Based Practice in Children and Young People's Mental Health. And as Tim mentioned, there are several challenges around bridging this gap between research and practice, and we know that it's not easy or straightforward. I think that being said, there are many opportunities too, and we can improve the implementation of evidence. So our priorities are really about moving things forward beyond the learning and scoping that we've already done to leverage change and impact. Now, to do that, we've developed a brief survey tool to measure the barriers of implementation and practice, and we're also planning to publish top tips and recommendations, which we hope will be useful across clinical, commissioning and academic settings. So during our workshop at the summit, we'll discuss some practical applications of implementation frameworks, as well as our key learning and top tips for those with an interest in implementing research into practice in both research and clinical settings. And it's going to be a really kind of interactive and hopefully interesting session for those involved. So do come along, and we look forward to seeing you then.
What is going to happen in the workshop?
So we are going to do a bit of a presentation at the start. So it's really about kind of presenting our key learning practical tips. So that'll be fully accessible to those online. And then the interactive elements are going to be online too, so that people that are joining us remotely can take part. So we're going to have lots of kind of Mentimeters and different things that are done online for people to participate and get their views across. And we'll have facilitators who will be online too to help involve those joining us remotely. So it'll be for everyone, not just those in the room.
Who is the workshop for?
Everyone who has an interest, however small, in implementation, working, commissioning, research settings or clinical settings. It's really for everyone. So yeah, if you have interest in this area, or you're working in children and young people's mental health and want to know more about implementation, then do come along.